You already know that sitting has been termed the new smoking, the structural equivalent of metabolic syndrome in terms of ill health effects associated with a sedentary lifestyle. So how do you reverse the physiologic effects of a sedentary lifestyle? Did you know that standing is not the answer, and that performing an hour of exercise per day is considered inadequate to offset the ill effects of sitting? Prolonged sitting causes the body's metabolic function to be inactive. The joints stop moving, the muscles aren't firing, and the heart rate slows. The body's calorie burning rate plummets to about 1 calorie per minute, which is just about 1/3 of what it would be if you were up walking around. Insulin effectiveness thus drops and fat and cholesterol levels rise, increasing the risk of developing type 2 diabetes. Structural compromise is also very debilitating to the posture system. While in a seated position, the pressure in the low back is increased by about 1.7 times your body weight. And this is when you're sitting with proper posture. If you slouch, that pressure increases even further. The spine is generally strong enough to tolerate the pressure of a slouched spine for about 20 minutes before the vertebral discs start to absorb that extra pressure. So what is the answer? If a modern day occupation requires prolonged sitting, as a society, how can we preserve our health while performing necessary job-related tasks? How can your patients have a higher level of function and offset those ill health effects of sitting? It's not about how many hours of sitting that's bad for you. It's about how often you interrupt that sitting position that's good for you. It's actually the change in posture that is the most powerful in terms of having a beneficial impact on your health, not the act of standing in and of itself. Correcting postural distortion patterns and educating your patients of the importance of proper postural hygiene habits will dramatically change the quality of your patients' lives. In the world in which we live and function, those with symmetric postural design will have increased biologic sustainability. It's always posture by design, not by circumstance.